Hi, I'm Armand Budish, your county executive, and I'd like to welcome you to another conversation with the county, which is our new web video series. We want to keep you informed about topics that are important to you and to us. Right now, I can't think of another topic more important to me and to our community than the recent report on conditions at our county jail. Over the summer, we had several deaths in our jail. In fact, we had 6 people die as a result of suicides and drug overdoses. And we had a 7th death when one of our inmates was very ill with cancer, and we moved him to the hospital where he could more comfortably see his family. He passed away in the hospital. Even one death is unacceptable. I take the safety of our inmates and our staff very seriously. That's why I asked for the U.S. Marshal's Office to come in and do an independent assessment of our jail. They are the best, and they do these assessments all over the country. The report I got back was terrible. The Marshals gave us an unacceptable at-risk rating for many areas. Now, how come we didn't act sooner? For the past few years, we've been relying on state inspections. They come in annually or more often to inspect the jails. We received high marks from the state in every inspection since I've been in office. Every one. But after the deaths, I wanted another in-depth evaluation. That's why I brought in the Marshals. Clearly, there's a huge disconnect between the state reports and the Marshals report. We're now doing everything we can as quickly as we can to address the concerns in the report. The first thing I've done is to reach out to the American Corrections Association, which has established national standards for correctional facilities. They are the gold standard. This association will come in and assess conditions, review the Marshals report, and give us specific recommendations for fixing the problems. We're also starting a national search for a jail director who has significant experience in corrections. And we've begun to address all of the issues in the report. Some are ones that we can address quite quickly. Others will take time and effort. But I commit to you that this is a top priority to me and to my leadership team. There are other very important issues that impact our jail and our jail populations. This includes overcrowding. Jails across the country are overcrowded. So Cuyahoga County is not alone in this challenge. Here's how we are tackling overcrowding. We're working with our local judges on criminal justice reform so that we can keep low-level, nonviolent offenders out of our jails in the first place. We're working on a new jail diversion center, which will be completely focused on inmates who have mental health and addiction issues. Our jails have become, like so many others in the country, the largest repository of people with mental health and addiction issues. This is not okay. This center will give us a place to provide housing and treatment for those with mental health and addiction challenges so that they don't just cycle in and out of our jail. Finally, but certainly not least, the jail itself is old and outdated, and that is where some of the problems stem from. The facility itself is a problem. So I'm working with County Counsel and Judge John Russo, who's the administrative judge for the Court of Common Pleas, on a collaborative plan to develop a new jail. As I said, some of the fixes are very complex and will take time, but we're laser focused on them, and we will be providing regular updates on our progress. Now I'd like to bring in Brandy Carney. Brandy's our Chief of Public Safety and Justice. She oversees the sheriff and the jails, among other things. Brandy, thanks for joining me today.
Thank you.
So you and the sheriff and our interim director of jails, you've already been hard at work fixing things. Can you tell us where you are, what you've been doing already?
Sure, absolutely. Obviously, we're all dedicated to making sure that we get things right and move forward and address the problems that have been identified. Currently, we are looking to put in place a kitchen contract where if our kitchen needs to go offline or food couldn't be served for one day because of upgrades to the building, that someone could come in and immediately provide those services. We're also
So
looking.
that's like a backup in case something happens.
That's correct.
Okay.
Someone else in case of an emergency or an immediate need.
Mm-hmm.
We're also looking to possibly hire someone to manage the kitchen. So someone with experience in meal planning, nutrition planning, that would make more sense than us internally doing those types of jobs.
Okay, good.
We have put shower curtains throughout the whole facility. Cleveland Division of Fire, who is our local city fire inspection, they recently signed off on our annual fire evacuation and inspection plan, and they do that every year.
What about the juveniles? You know, we have some juveniles in the jail, and there was some criticism about whether they were being segregated appropriately.
So we have made sure that the juveniles at this time are appropriately by sight and sound segregated from all of the other adult inmates within
that's
the
already
facilities. That's correct.
Okay. Food for the juveniles.
Sure, so there was concerns raised within the report regarding the food that they were receiving. Right now, they are all receiving their 3 meals a day as well as milk portions, and they each also receive a nighttime snack that they're able to take with them.
And you've already brought in the school district to help with educating the kids while they're in our jail?
Sure, so obviously training is so important for the people in there. It's an opportunity for them. December 10th, we have Cleveland Metropolitan School District coming in and starting training programs for the facility.
Good. Now you've got a good start on things in the Marshall's report, but going forward in the near term, what do you have on your agenda?
Sure, well, as you said, we're looking forward to working with the American Corrections Association to see what recommendations and improvements they have to offer. Training is significant, working to train. We have close to 600 correction officers, a lot of supervisory staff, so training for the staff as well as on our policies and procedures, making sure that they're all adequate, that people are aware of them, they train on them, and if improvements need to be made, that those are made and made aware to everybody else that need to follow those.
Brandy, healthcare in the jail, it's difficult, more difficult than in our normal lives. Especially when we're dealing with people with severe mental health problems and addiction problems. What are we doing in the jail to deal with that?
Absolutely. So we're lucky to have Metro Health Hospital, and we have asked them to look at our current operation, which they partner with us, and expand their role, so to take over the entire medical operations within the jails. So currently they're working with a local consultant that has knowledge on jail medical, and they'll provide a proposal to us, and then we'll work with them to possibly implement that, so they are leading all of the medical needs and necessities in the jail.
We've had this awkward split in the jail between the county hiring nurses, but the Metro Health has been doing just the medical care, and it doesn't work that well when it's split. So by having Metro take over the whole thing, you're comfortable with that? You think that'll be a better way to go?
Absolutely. Their job, they're used to hiring the nurses and the physicians on a day-to-day basis. That's not something that we as the county are used to. So those as professionals in setting up that staffing and structure, I think will be really valuable to how the jail operates moving forward.
Great. Brandy, you got a big job. You and the sheriff and Chief Taylor are jumping right in, and I really appreciate that. Thank you very much.
Thank you.
I also want to thank the entire staff over at the jail for the hard work they're doing to make improvements, to make sure that our prisoners are all protected and safe. And thank you for joining me. This is a difficult topic, but one that I want to make sure I address with you. And as I said earlier, I commit to you we'll be providing regular updates. Thank you.